up to the death of a person, heart plays a major role in pumping the blood. We know that there is around 6 to 6.5 liters of blood in the body, and that needs to be pumped from the heart to the periphery and from the periphery to the heart again. So this function starts during embryonic period at around 21st day of embryonic life till death. So it never takes any rest. Continuously it pumps. When it takes rest, ultimately it is the end of the life. We know the ECG curve. That curve has got the typical PQRST waves, and which if it ends, then it becomes a straight line. So heart has got several chambers, you know. It has two chambers on the right side and two chambers on the left side. So the right heart actually performs, here what happens from the periphery, that means either from the superior aspect of the body or the inferior aspect of the body, that means the superior vena cava and inferior vena cava blood ultimately drains into the right heart, and precisely into the right atrium. From the right atrium, it goes to the right ventricle, and from the right ventricle we know the right heart contains poorly oxygenated blood, so it needs purification. So the blood from the right heart through the pulmonary bay or pulmonary trunk, it goes to the respective lungs from the right and left pulmonary artery. It reaches the right and left lungs, where there is a purification process takes place, and the oxygenated blood ultimately comes through the pulmonary veins and ultimately which drains into the left heart, that means in the most precisely the left atrium. From there blood reaches the left ventricle, and from the left ventricle it reaches to the aorta. From the aorta, ultimately it is ejected during the systolic contraction of the ventricle. It goes to the periphery through aorta and its subsequent branches. Now heart is mainly, it has got a fist-shaped appearance, its own fist. This is the apex, behind is the base, and it is inside the thoracic cage. And we already have got ideas about the mediastinum. We know there is a middle mediastinum. The middle mediastinum is a space between the anterior and posterior mediastinum. So heart is enclosed in a double jacket covering. That means outer covering of fibrous pericardium and inner covering of serous pericardium, and that serous pericardium again has got one layer is intimately attached to the heart, that is the visceral layer, and another is reflected on the periphery, that is the parietal layer. So within that area, that is within the middle mediastinum, we get the heart. Okay. Now we can, it's a absolutely a diagrammatic representation. Okay. So here we can find on the right side, this is the right surface, on the left side, left surface, this is the apex, this is the inferior border, this is the superior border, and so on. So already I have said these things, okay. Now this is what you are getting, more or less the image of a heart. Here you can find, this is the right and left brachiocephalic trunk. You have seen in the cadaver, in the superior mediastinum, which joins to form the superior vena cava, which drains into this part of the heart. And it is visible from the front, that is the right atrium. Similarly, blood from the lower part of the body coming through the inferior vena cava, it also reaches this right atrium. From above, the superior vena cava, from below, the inferior vena cava, which is not shown in this diagram. So ultimately it reaches the right atrium. From here, through an opening which is in between the right atrium and right ventricle, that is there is inside we will get an opening which is not visible from the front, okay. So blood will reach to the right ventricle. From here, the blood will go to the pulmonary trunk and it will go to the respective lungs. And so this is the right ventricle. And from the front we can see also a part of the left ventricle. So right atrium, right ventricle, and we can see the left ventricle. And this left ventricle has communication with the aorta. From the aorta, blood again goes to the periphery. So there are some borders of, like from superior vena cava, the border which is connecting the superior and inferior vena cava forms the right border. Similarly, on the left side, we can get another border, that is the left border, and it is formed by this left. We can find a tongue-shaped area here, that is the left auricle. So it is formed by this left auricle and by the left ventricle. So this is the right border and this is the left border. And another border we can find here on the lower side, that is the inferior border. And another border we can imagine through this is the right auricle, right atrium, right auricle, and then the aorta, then the pulmonary trunk, then the left auricle. Just above the left auricle we can imagine another border which is called the superior border. Now it has got a conical shape, and this part is called the apex, and the part which is not visible here, actually it is the image from the front. The back side is not visible. the back of the heart is called the base, which is contributed by the left and right atrium. So, heart has got apex and the base is directed on the posterior surface is the base. Okay. So now, what is the length? From apex to base is around 12 to 15 centimeters. And the maximum width, okay, at any point it becomes 8 to 9 centimeters, and the weight of the heart is around 300 grams. This is the posterior view of the heart. If you see the heart from the back, then you can see this thing. So this part is contributed by, on the left side, that is the left atrium, and on the right side by the right atrium, and this is the groove between the atrium and the ventricles. So this is the atrioventricular groove or the coronary sulcus it is called. So this is the posterior view where we can get the left atrium, and within the left atrium we can see 4 veins drain. 1, 2, 3, 4. These are the pulmonary veins. 2 right pulmonary veins and 2 left pulmonary veins. They drain into the atrium. From the atrium, it will reach on the left side, there is a left ventricle. From left ventricle, it will reach the aorta and blood will come to the periphery. So, another thing we can see, this is the aorta and also these 2 major trunk, that is the pulmonary artery, which is arising from the from the right ventricle, and it divides into left and right artery, and it goes to the lung, and from the lung blood comes and it enters into the pulmonary veins. Now here we can see the superior vena cava and inferior vena cava nicely. This is the superior vena cava and this is the inferior vena cava. So this part is the right atrium. So this part is called the posterior surface or the base. This part only, the left atrium and the right atrium constitutes the base or the posterior surface of the heart. Not this one. This is placed on the diaphragm. So this surface or the ventricular surface, both by the right or left, it is resting over the diaphragm. So it is not the base. Base is only contributed by the left atrium and the right atrium. Left and right atrium. You can see the left atrium contributes the major part. From the figure, from the diagram, you can appreciate that left atrium contributes the major part, which is around 2/3 of the base. It contributes 2/3 of the base, whereas the right atrium contributes only 1/3 of the base. Clear? Now you can see the apex here. It is directed, this is the right side and this is the right side, this is the left side. So this is the apex, and if I go to the previous picture, this is the base. So base is contributed by this is the right ventricle and this is the left ventricle. Okay, this is the anterior interventricular groove. So base is solely contributed by the apex. Again, we can see the apex from behind. So this is the apex. Now this apex has got it is very important. It is where it is located. It is in the 5th intercostal space, 9 centimeter away from the midline. So let us count. This is the second one. The first one is covered by the clavicle. Second space. Third, fourth, fifth. This is the 5th space. And around 9 centimeter away from the midline. So this becomes the apex, position of the apex, which is more or less at the just medial to the mid-clavicular line. Just medial to the mid-clavicular means in an imaginary line which can be drawn through the midpoint of the clavicle, which is called mid-clavicular line. So this is on the 5th intercostal space and 9 centimeter away from the midline. That is the apex of here lies the apex of the heart. And here we can we feel in the clinics, we palpate the apex of the apical impulse. There is downwards, outwards thrust, downwards and outward thrust of the cardiac impulse, which is called apical impulse, which can be felt here. So apex and apical impulse are two different things. Apex is the particular point of the heart, and apical impulse is the impulse generated from the apex, which is felt by or palpated by the clinician in the same place. Okay. So and we can see the position of the apex downwards, forwards and to the left. And it is just medial to the mid-clavicular line or 9 centimeter away from the midline and in the 5th intercostal space. And it is very important point regarding the surface anatomy. Okay. You have to put a point here in surface anatomy. That is the apex. Oh, yeah, that same apical impulse and everything. So site of here we can see the site of the apex and also the apical impulse. Okay, we can feel. Now what is called the base? Base is the posterior surface. Base is nothing but the posterior surface. Apex is directed downwards, forwards and to the left. Apex is directed downwards, forwards and to the left. So similarly, base is directed backwards, that means upwards, backwards and to the right. Just opposite. Here, if the apex is directed here, this is that means it is directed downwards, forwards and to the left. Similarly, if the base is just opposite, so it should be upwards, backwards and to the right. Okay, and it is contributed by the right and left ventricle. Right and left atrium. Right only contributes 1/3, whereas left contributes the 2/3. And here we can see there were different veins, and these veins we can see they open like we can see these veins looks like a J, inverted J. We can assume an inverted J. Superior vena cava, inferior vena cava, superior vena cava, then the pulmonary veins. Okay, so you can see this is the inferior vena cava, right pulmonary veins, superior vena cava, then pulmonary veins, or left pulmonary veins. So if I join all these openings, then it will form a inverted J. And this base is very important. It is posteriorly placed. Posterior to the base, what we will get? The structures of the posterior mediastinum. The behind the base, what we will get? The structures of posterior mediastinum. We know the structures in the posterior mediastinum are, one is food pipe is coming down, that is esophagus. So behind the base we will get the esophagus. Behind the esophagus we will get thoracic duct. Behind the thoracic duct we will get the vertebrae, thoracic vertebra, and other things like azygous vein on the right side and descending thoracic aorta on the left side. So base is related posteriorly to all these structures. Okay, like esophagus, thoracic duct, azygous vein on the right side, descending thoracic aorta on the left side, and the vertebrae, thoracic vertebrae. How many thoracic vertebrae? In standing position, the 6 to 9 thoracic vertebrae are related. And in lying down position, 5 to 8. 5 to 8 vertebrae comes in relation. And we know this area, we know it is covered by the pericardium. In between the pericardium and if we can put our fingers in between the pericardium and the base, that area is called oblique sinus. Oblique, in between the base and in between the pulmonary veins and pulmonary artery and pulmonary and the aorta in front, this artery in front and vein behind, this area is called the transverse sinus. So there are two pericardial sinuses. One is oblique sinus. So if we place our fingers just at the posterior surface of the heart, that becomes that area is the oblique sinus. And if we place our fingers in between aorta and pulmonary trunk in front and the veins behind, that is the transverse pericardial sinus. And these two sinuses are very important for those for whom orthopedic surgeons, neurosurgeons, cardiothoracic surgeons, yes, cardiothoracic surgeons. Okay, so during cardiac surgery, they actually approaches through this either transverse or the oblique sinuses. Okay, it is their cup of tea, so we will not go beyond our limit. Okay, now our concern is about the apex, base, right surface, left surface, diaphragmatic surface, so and so, and borders. And what is called the crus of the heart? We know this is right atrium, this is the right ventricle, this is right atrium and this is the left atrium, and in between we can get a groove. Groove means any depression. That groove is called in between two atrium, that is interatrial groove. Similarly, we can imagine another groove in between the right ventricle and the left ventricle. Okay, that is called the in between two ventricles, interventricular groove. So, and another groove we can imagine in between the atrium above and ventricle below. That is the atrioventricular groove. Okay. So, this atrioventricular groove, interatrial groove and interventricular groove will meet at this point, and that point is called the crus of the heart. So, what is crus of the heart? Crus of the heart is nothing but the joining point of interatrial groove, interventricular groove and atrioventricular groove. Okay. Now, why it is important? To the left, just to the left of it, there is an anastomosis between the right coronary artery and left coronary artery. From the right side, right coronary artery, from the left side, left coronary artery, they anastomose with each other. So that area is called, so just to the left of the crus, we can get, here is the anastomosing point. So, I have already mentioned about the base, the posterior relation, that is, you can see oblique sinus, pulmonary vein, descending thoracic aorta and all. Okay. Now, what is clinical base? What is clinical base of the heart? Clinician they are interested about that base of the heart. That is this is the second intercostal space. So, this area and this area, you can see this area and this area is very important for them. One just right to the sternal border in the second intercostal space, and another in just left to the left sternal border and on the second intercostal space. This is the aortic area and this is the pulmonary area. Okay. So, second intercostal space, you can see the aortic area is on the second intercostal space, just on the right side, on the left side is the pulmonary area. So, these are important for the clinicians because they put their stethoscope over that area and they try to feel the heart sounds. That is, they actually want to hear the heart sounds and other heart sounds, normal heart sounds like first heart sound, second heart sounds, or any other added sounds, or any murmurs are there or not, they can feel. Okay. Aortic stenosis. On the aortic area, you will get a murmur. If there is a pulmonary stenosis, you will see the physician can hear a murmur with the help of stethoscope. So that is the clinical area. Again, the same picture of the base. Now about the surfaces, we are seeing this surface from the front. Actually, it overlies the sternum and the ribs. Okay. So this surface is called the anterior or the sternocostal surfaces. Similarly, on the left side, this surface is called the left surface. This is right side. So this is the right surface. Similarly, on the left side, this is the left surface. And another surface which is resting over the, what we are getting? Diaphragm, on the central, majorly on the central tendon of the diaphragm. And that part is called the diaphragmatic surface. So, in front, sternocostal surface, behind, base or the posterior surface, on the right side, right surface, on the left side is the left surface, and the surface which is resting over the diaphragm, that is diaphragmatic surface or inferior surface. And below the diaphragm, what we will get? The peritoneum. Peritoneum, what is peritoneum? At this moment, just I should call you, that is a layer which is covering all the viscera of the abdomen, that is a peritoneum. Like pleura, there is another serous layer, serous cavity, which is called peritoneal cavity, and it has got a sheath covering. So this is peritoneum. And below that, on the right side, we will get the liver, on the left side, we will get the spleen and also the stomach. The inferior surface is related to, on the right side, to the liver, and on the left side to the stomach and spleen. Okay, part of the spleen. So, there are so many surfaces. Now about the sternocostal surface, you can see it is majorly contributed by the right ventricle and small part by the left ventricle, and we can see the right atrium also, as well as this tongue-shaped area is called the right auricle. So, right atrium and right auricle, right ventricle, left ventricle, and also another tongue-shaped projection which is called left auricle. They are forming the sternocostal surface, majorly by the left ventricle, right ventricle, and right ventricle to left ventricle. There is the contribution is right ventricle and left ventricle. Contribution is around 2/3 by the right ventricle, 1/3 by the left ventricle. You can see it is very apparent from this picture. 2/3 by the right ventricle and 1/3 by the left ventricle. Okay. And on this surface we can find one groove here in between the atrium and the ventricle. This groove is called anterior part of the atrioventricular groove. Similarly, on this side, we can find another groove between the left atrium and the left auricle and the ventricle. So, this is the left part of the atrioventricular groove. And another groove we can find in between right and left ventricle, that is the anterior interventricular groove. So, we can find the sternocostal surface as well as so many grooves. Atrioventricular groove, right part, atrioventricular groove, left part, and this is the interventricular anterior part of the interventricular groove. Now, actually coronary artery, there are two coronary artery arising from the ascending aorta. This is the ascending aorta. From here, one coronary artery arises and it passes through this groove, and another artery which is called left coronary artery arises, which is called left coronary artery, which ultimately divides into two branches. One is left circumflex branch and another anterior interventricular branch. So, this anterior interventricular branch group contains the anterior interventricular branch of the left coronary artery. Similarly, this atrioventricular groove contains the right coronary artery. There are three arteries in bypass surgery or in angiography. We are concerned with three vessels. You might have heard in your family that it was a triple vessel disease, double vessel disease, single vessel disease. That means there are three major arteries which are supplying the heart. The coronary, what is coronary artery? Coronary artery, actually they are supplying the heart. Okay, one coronary artery, the right coronary artery, it is supplying the right part of the heart, and left coronary artery, it is supplying the left part of the heart. Okay, so this left coronary artery has two branches. One is left circumflex branch and anterior interventricular branch. So these three artery, right artery, anterior interventricular branch and the left circumflex, these three arteries are the major arteries. Among them, this artery which is traveling in this groove in between the right and left ventricle, which is called anterior interventricular branch, or in the cardiac surgeons or cardiologists or cardiac interventional cardiologists, they call it as LAD, left anterior descending. Left anterior descending. We can see that artery also. We can see the artery, the image of the artery. That is the left anterior descending artery, LAD, which is also called the widower's artery, because if this artery gets blocked, actually this artery is the the main artery for the left ventricle. It supplies major part of the left ventricle, and if that major part of the ventricle is compromised, what will happen? It will not get it in nutrition. So there will be cardiac arrest. If the block is severe, it may cause sudden cardiac arrest and sudden cardiac death. So, which is commonly called by the layman heart attack. Heart attack হয়েছে. That is this very important artery which is traversing through this anterior interventricular branch, which is the anterior interventricular branch of the left coronary artery, gets blocked. Okay. So this group contains anterior interventricular branch, and along with another vein, major vein of the heart, that is the great cardiac vein. Artery moves from here to this side, and from here that vein moves from here to this side. This is the great cardiac vein. Similarly, on this group we will get the right coronary artery and another vein which is called, if it is great, then this vein will be called as small cardiac vein. Okay. Here you can see this groove is coming down and ultimately it ends near the apex, and near the apex we can get another groove. This groove is called incisura apicis cordis. So incisura apicis cordis is basically a notch which is just medial to the apex of the heart and which is in projection to the anterior interventricular groove. Okay, it is continuation of the anterior interventricular groove. Similarly, here we can find so this is the posterior surface we know, and this is the surface which is resting over the diaphragm. So this surface as a whole is called the inferior surface, and you can see, or the diaphragmatic surface or the inferior surface, which is contributed majorly by the left ventricle, 2/3 by the left ventricle, 1/3 by the right ventricle. Okay, and here we are getting posterior part of the atrioventricular groove, where we can find a major vein which is called the coronary sinus, which is where we can see, which is continued from the left and it is going to the right side, and this coronary sinus drains into the right atrium. So major venous channel of the heart, you can see it here. This is the coronary sinus which is placed in the posterior part of the atrioventricular groove, and this groove is also called the coronary sulcus. Coronary sulcus. And here also in between right and left we are getting another groove which is called the posterior interventricular groove, where we can get we can see the right coronary artery is coming, going to the left side. During its journey, it gives a branch to this, which is lodging in this groove, which is called posterior interventricular branch of the right coronary artery. Okay. On the left side, we are getting the left coronary artery. This is the anastomosis point between the right coronary artery and the left coronary artery. খেলা তো অর্ধেক শেষ, তোমরা দেরি করে ঢুকলে? হ্যাঁ, খেলা শেষ, শো তো অর্ধেক শেষ হতে চললো। So we can see the diaphragmatic surface contributed by the right and left ventricles. Diaphragmatic surface of the inferior surface. What is left surface? On this left side, it is contributed by the left ventricle and also by the left auricle. And here we can find one groove which is called the left part of the atrioventricular groove, where we can get the circumflex branch of the left coronary artery. And also this vein is coming, which is known as cardiac vein. So here cardiac vein and the left circumflex of branch of the left coronary artery. Similarly, this is the right surface, okay, contributed by the right atrium, and here we can get one groove which is connecting the superior and inferior vena cava, which is called the sulcus terminalis. Now, what is area of superficial cardiac dullness? Due to the bulging effect of the left ventricle, the anterior border of the left lung deviates from the midline, from the fourth intercostal space, and it goes to the left side. Again it forms a notch, and ultimately it comes at the sixth intercostal space. So this is called the cardiac notch. So due to presence of the cardiac notch, a part of the heart is coming directly on just behind the sternum. Directly it is coming. So lower part of the lower two segments on the left side, the lower two segments of the sternum on the left side, actually it comes directly with the pericardium and the heart. There is no lung. Actually, the lung actually covers the heart. Here is right lung, here is left lung. So it covers the heart. But one area of the heart is not been covered on the left side by the heart. So that part of the heart is coming directly over the sternum. And within the heart, we can get the blood. So if we percuss over that area, if we percuss over the area of the lung, there will be pneumatic sound. If we percuss it over the lung, lung contains air, so there will be resonating sound. But if we percuss just over the heart contains blood, fluid, so there will be a dull sound. So if we, that percussion over the heart, that area over the heart, that area just which is over the sternum, if we percuss here, we will get a dull sound. That area is called area of superficial cardiac dullness. Why? Because due to the bulging effect of the left ventricle, anterior border of the left lung is deviated on the left side. So a part of the heart along with the pericardium is just coming behind the sternum. Over the left two pieces of the sternum. So that is called area of superficial cardiac dullness. This area is shown here. Here, if we percuss, and if we percuss over the lungs, we will get the pneumatic sound, resonating sound. You can feel it on your lung. There will be a resonating sound. But if we percuss it over this area, there will be a dull sound. Okay. You can see this is you can see the anterior border of the right lung and pleura. Okay, there is no deflection. Whereas the anterior border of the left lung, it deviates. Okay, so here we can find a dullness. That dullness is called area of superficial cardiac dullness. This is the inferior border. Superior border, inferior border, left border, right border. Right border, actually it is continued from the superior vena cava to inferior vena cava. Left border from the left atrium to the apex. Okay. And inferior border, this is the inferior border. It is majorly contributed by the right ventricle and partly by the atrium, right atrium and the left ventricle. So it is from the apex to inferior vena cava. This is the inferior border. And along this border, we can get one branch of the right coronary artery, which is the marginal branch. ওটা পরে জানবে, ওটা এখন না বললেও হবে. So groups already I have mentioned, the coronary sulcus, atrioventricular group, then interatrial groove, okay, and also I have mentioned the structures which are present. Now interior of the right atrium, কৌশিক করবো আজকে, বলবো বলে দিই. Interior of the right atrium, if we cut the right atrium, okay, then we can find this picture. This part is cut from this area. From superior to inferior, we have given an incision. Ultimately, we can see the interior of the right atrium, where we can get the anterior part is rough, the posterior part is smooth. The anterior part is called it is developed from the atrium proper, remember. Anterior rough part, here we can see some muscles which actually radiates from this ridge. This ridge is called the crista terminalis. From here, some fibers are radiating. These muscles are called musculi pectinati, like your comb-like fashion. Okay, they are projecting. So this rough area is called the atrial proper, which develops from the atrial proper, and this area actually develops from the right horn of the sinus venosus. So that part becomes smooth. Heart develops from several, you will know, it develops from two tubes, endocardial tubes, they merge, they form sinus venosus, atrium, ventricle proper, okay, bulbus cortis. You will know gradually. But just remember, at this moment, this smooth part develops from, smooth part is called the sinus venorum. The posterior smooth part of the atrium is called sinus venorum, which develops from the right horn of the sinus venosus. Left is right horn, left horn. Left horn degenerates. Only the right horn remains. From the right horn, we get the vasa vasorum. Okay. So, this area is called sinus venorum. Sinus venorum. So this part is called sinus venorum. So here inside what we will see, this is the opening of the inferior vena cava. Here we will get the opening of the superior vena cava. This is the opening of the, we can find the opening of the superior vena cava. We know the opening is of the superior vena cava is related to pacemaker of the heart. SA node, sinoatrial node. There are some conducting system, like electrical channels, which conducts the electricity. In the electrical channels, we know electrical wires conducts the electricity. So similarly, in our heart, there is conducting system. The cardiac cells becomes highly specialized, okay, and they becomes the conducting system, okay. They are called the SA node, AV node, bundle of His, Purkinje fibers. Already you have some idea in your +2 level, okay. So conducting system, that is the SA node, is the most important. So here we can find the position of the SA node. Similarly, this is the inferior vena cava opening, and which is guarded by one rudimentary valve, which is called valve of the inferior vena cava. Okay. Another thing here we can get, this is the opening of the coronary sinus. That sinus we are seeing on the posterior or the base of the heart. We are seeing one venous channel that is called coronary sinus that opens into the right atrium, and which is also guarded by a valve, or which is called the valve of the coronary sinus or Thebesian valve. Okay. And another thing, other parts are smooth, and this part is the part between the right atrium. This is the septum between the, what we are seeing, this is the view of the septal wall of the atrium from the right side. Here we can see one depression. This depression is called fossa ovalis, and above the depression that we can find for a curved ridge, which is called limbus fossa ovalis. Limbus means ring like. Limbus means, limbus, what is the meaning of limbus? Ring. So one ring like ridge, subendocardial, there is an endocardial ridge which is called the limbus fossa ovalis. This limbus fossa ovalis, just remember, is, and the fossa ovalis is the part of the septum primum. Just remember, there two septum develops within the atrium. Okay, the interatrial septum. Okay, one develops at 6 weeks, another develops in the 8th week. One is septum primum and another is septum secundum. So it develops from two septum. The interatrial septum develops from primitive septums. One is septum primum, which appears at 6 weeks, and another appears at 7 weeks onwards. Okay, that septum secundum is very thick, and septum primum is pliable, it can move. So this fossa ovalis is a part of the septum primum, and limbus fossa ovalis is the septum secundum. And in between we can get an opening which is called foramen ovum, oval, foramen oval, okay, through which the right atrial blood passes to the left atrium, okay, during embryonic stage. And after the establishment of the pulmonary circulation, the septum primer gets fixed with the septum secundum. So this opening gets blocked. Okay. So foramen oval gets blocked. So no flow from the right to left, only from the left to, and there is no flow from the right to left or from left to right. Okay. So at this moment, if you forget everything, forget fossa ovalis and limbus fossa ovalis. Fossa ovalis is the part of the septum primum, and limbus fossa ovalis is the part of the septum secundum. During embryology of the, during the study of the embryology of your heart, it will be absolutely clear, I think. Again, another thing we can get, this is the opening between the right atrium and the right ventricle. This is the atrioventricular opening, which is guarded by tricuspid valve, which has got 3 cusps, anterior, posterior and septal cusp. Okay. There is one triangle of Cox which is called, which is bounded anteriorly by this base of the atrioventricular opening, behind by the opening of the coronary sinus, above by a ridge which is called subendocardial ridge. This is called triangle of Cox, where we get the AV node, atrioventricular node. Okay. Location, it is located in the triangle of Cox, which is been formed by the base of the right atrioventricular opening and coronary opening, and above by the subendocardial ridge, which is called tendon of Todaro, which is the triangle of Cox. We can see this is the opening in embryonic stage. This opening is called, okay, the foramen oval, from right side to left side. Okay. Now about the right ventricle, we can see there are 2 parts. One is inflowing part. This is the atrioventricular opening. From here blood is coming and it is flowing on the walls. So this part becomes rough, and this is inflow tract, and this is the outflow tract through the pulmonary trunk. So this outflow tract is smooth, and in between there is another ridge which separates the smooth part and the rough part of the right ventricle, that is called supraventricular crest. Supraventricular crest. In the right ventricle we are getting one rough part, one smooth part. The inflowing part, the blood which is coming down and flowing on it, the inflowing tract, it is rough. And the outflowing tract is smooth. In between we are getting one separating ridge which is called supraventricular crest. And within this rough part we get some ridges, bridges and pillars. Ridges means fixed elevation. Bridges means there is one elevation, another elevation, and one thing is connecting in between. Okay. And there are some pillars. We can see these pillars. Okay. We can see one pillar which is arising from the anterior wall, which is called anterior papillary muscle. Another is arising from the inferior surface, which is called posterior papillary muscle. Another the pillar which is called the papillary muscle, which is arising from the septal wall, which is septal papillary muscles. And we can see these papillary muscles are conical in shape. It has got apex. We can see this is apex and this is the base. And this, from the apex, some thread-like structures comes out and they are attached to the septal cusp. They are called the chordae tendineae. Chordae tendineae are some thread-like structures which are coming from the papillary muscle and it connects the septal cusp. Okay. So, and another, this is the interventricular septum. From the septum, interventricular septum, we can find one bridge is coming and it is continued up to the anterior papillary muscle. This bridge is called the septomarginal trabecula. স্যার ছেড়ে দিন আর পাচ্ছি না তাই তো আর নিতে পারছি না তাই তো দাঁড়াও and just remember we know SA node AV node divides into right bundle and left bundle of his that this septomarginal trabecula contains the right bundle. Okay. And it is continued to the anterior wall. Okay. So, that is again the conductive system of the heart. You can see this is the heart. This is the apex of the heart. And this is the base of the heart, posterior surface. And the surface which is resting over my palm, that is the diaphragmatic surface. You can see this is the diaphragmatic surface. So, this is the sternocostal surface. And you can see this is the auricle, right atrium, and here you can see this projection is the right auricle. Similarly, the left atrium and this is the auricle. So, this is the apex, this is the sternocostal surface. Hey, Rocky, so here we can see, and there are two major arteries arising. This is the pulmonary bay, pulmonary trunk, or this is the initial part is called the infundibulum, and this is the right ventricle. Okay, and from the right ventricle we can see there are so many papillary muscle and septomarginal. I will show you. First, see, this is the sternocostal surface. So, this is the right atrium. This is the right ventricle, this is the left ventricle, from here aorta arises, and this is the apex of the heart which is directed downwards, forwards and to the left, and this is the base which is directed backwards, posterior and to the right. The base is contributed by the right and left ventricles. You can see these are opening of the pulmonary veins. কাটা হয়েছে pulmonary veins. This is left side, right pulmonary veins, left pulmonary veins. Okay. So this is superior vena cava and this is the inferior vena cava, and here is the and here if we cut from superior to inferior vena cava, then we can see the interior of the right atrium. Okay, and you can see the interior of the right atrium. Here we can see the anterior part is rough and posterior part is smooth. We will open it. Okay, and here this is the opening through which we can see the right ventricle, and here we can see there are the anterior part is the papillary muscle, anterior papillary muscle. You can see this anterior papillary muscle. Okay, papillary muscle. And here inside you can see all follow. আলো ফ্ল্যাশ অন করো কেউ, এই দেখো পুরো পরিষ্কার দেখতে পাবে, আনন্দ পাবে দেখে। You can see the papillary muscle, anterior papillary muscle. These are the chordae tendinis and is a septal cusp. A cusp. This is the atrioventricular orifice. এই দেখো এখানে ফেলো, দেখো atrioventricular orifice. My forceps is within the atrioventricular orifice, and you can see the so many cusps. এই দেখো আলো ফেলো না, এত কিপটে কেন, আলো কি জমিয়ে রাখবে নাকি? এই দেখো দেখেছো, এই দেখো anterior papillary muscle, chordae tendini, এই যেগুলো দেখছো থ্রেড লাইক, এগুলো chordae tendini, দেখেছো? আর এই যে দেখো atrioventricular opening এর এখানে দেখো একটা তোমার ওই tricuspid valve-এর একটা কাস্প। Can you find the tricuspid valve? And here we can see the valve cusp, and it is the pillar. This is the anterior pillar, this is the anterior papillary muscle, and this is the chordae tendinis. Okay. Similarly, we can find এখানে আলো দাও, we can find from the septal wall, this is coming out and it is going to the from the septum, এটা ছিঁড়ে গেছে, from the septal wall this is coming, okay, and it is going to the anterior papillary muscle. So this is the septomarginal trabecula, the septomarginal trabecula. Okay,
Where is the valve?
tricuspid valve, you can see the opening is here. No, look, I am in the opening of atrioventricular orifice. এই যে দেখো, এই যে এখানে atrioventricular orifice. Okay, inside we can get the from atrium to ventricle. আরেকটা আচ্ছা, আমি আরেকটা হার্ট কেটে তোমাদের দেখাচ্ছি। এই রকি, এই রাইট এট্রিয়াম কাটা একটা দেখাও। সো রাইট এট্রিয়াম কাটা একটা দেখাও। সো রাইট এট্রিয়াম এরকম কাটা, আরেকটা হাত দেখো, এই দিকটা কাটা আছে, এই দিকটা কাটা আছে, এটা কাটা আছে, নালে এটা কেটে দেবো, আর কি করব, এটা কাটতে চাইছি না, এটা কাটতে চাইছি না, সুন্দর আছে বলে সবকটা দেখো না, আরেকটা হাট আছে কিনা। আচ্ছা দেখো, সো দিস ইজ দ্য coronary sulcus, it is C-shaped. Okay, C-shaped, it is the posterior part of the coronary sulcus or atrioventricular groove or coronary sulcus. This is the anterior part, this is also anterior part, this is right anterior part, left anterior part, this is the posterior part. Okay, here we can see this is the coronary sinus, it is opening into the right atrium. This is the coronary sinus. Okay, you can see the opening. This is the opening of the coronary sinus. This is the right atrium. Okay, here you can see the opening of the coronary sinus. So coronary sinus is the venous channel, okay, of the heart, major venous channel. So now these are the grooves. So in between the left ventricle and right ventricle, so this is anterior interventricular groove, and again this is
the right and this is the left ventricle. So, this is the posterior part of the interventricular groove. Okay. This part here, what happens? We are getting this artery. This artery is the this is the anterior descending branch of the left coronary artery, which arises from the, you can see it arises from the aorta. Look.
So
Left anterior descending, and this branch is the left circumflex branch. Okay, or it is continued. Okay, and it is another branch. This is the left. Here we will get the left coronary, left circumflex branch. Okay, and similarly on this side we will get the right coronary artery. I can feel the right coronary artery here. কাঁচি দিয়ে বার করতে হবে, ফিল করাই যাচ্ছে কিন্তু কাঁচা দিয়ে বার করতে হবে। রকি সিজারটা আনো তো। আচ্ছা যাক গে, আগে শুরু পড়িয়ে দিই এইটুকুনিটা। সো দিস ইজ দ্য right ventricle and this is the right atrium. Here, from here, the another artery will come out from this area in between the pulmonary trunk and the right auricle, and it will traverse in the same way. Okay, from right to left. Okay, the right coronary artery, and this right coronary artery will give this branch, which is called posterior interventricular branch. Similarly, from the left coronary artery, the circumflex branch in between, here we can see this circumflex branch, it will move. You can see this is not the circumflex branch, it is here. Okay, this is the anterior descending branch. This is the marginal artery. This is not the left circumflex. Okay, actually this will move in this area, and it will go to this groove. This is the groove for the left coronary artery, right coronary artery, and the this is for the right coronary artery, this is for the left coronary artery, and here it will form the anastomosis. So this is the anterior left anterior descending branch, circumflex branch, and right coronary artery. Okay, so this is the anterior part, right anterior part of the atrioventricular groove. This is the left and left anterior part of the atrioventricular groove, and this is the posterior part of the interventricular groove, and this is the interatrial groove, and this is the interventricular groove. This is the coronary sulcus. So this area is the crus of the heart. So this is the inferior surface, this is the sternocostal surface, this is the left surface, this is the right surface, this is the inferior border. Okay, this is the right border. Okay, right border from superior to inferior, this forms the right border. This is inferior vena cava and this is superior vena cava. This is the right border. Okay, this is the left border, majorly contributed by the left ventricle and also by the left auricle. This is the base. Okay, base is contributed majorly by the লেফট এট্রিয়াম, এই যে লেফট এট্রিয়াম, লেফট এট্রিয়াম অ্যান্ড দিস ইজ দ্য রাইট এট্রিয়াম। ওকে, দিস ইজ দ্য লেফট এট্রিওভেন্ট্রিকুলার অরিফিস। এই যে দেখে এট্রিয়াম থেকে দেখো দেখা যাচ্ছে, এই যে ইউ ক্যান সি, দেখো দেখো আলো ফেলো, আলো ফেলো, এই দেখো এই যে লেফট এট্রিওভেন্ট্রিকুলার অরিফিস। ওর মধ্যেও একই রকম ওরকম প্যাপিলারি মাসেল টাসেল ভেতরে দেখতে পাবে। দেখো, দেখেছো কডি টেন্ডিনি আছে, আছে। দেখো এখান থেকে দেখো কডি টেন্ডিনিগুলো পরিষ্কার। এ দেখো, এটাকে দেখো, আলো ফেলো, প্যাপিলারি মাসেল, অ্যান্টিরিয়র প্যাপিলারি মাসেল, ঠিক আছে। তারপরে কডি টেন্ডিনি, আর এই যে এই যে এই যে এই যে ভাল্ব কাস্প, এই যে এটা ভাল্ব কাস্প যেটা দেখতে পাচ্ছ, যেটা তারপরে ফেলছি ভাল্ব কাস্প, ঠিক আছে। এটা হচ্ছে এট্রিওভেন্ট্রিকুলার ভাল্ব। ওকে, এই যে এই এট্রিওভেন্ট্রিকুলার ওপেনিং দেখো, তিন আঙুল ঢুকে যাবে, এই দেখো এট্রিওভেন্ট্রিকুলার ওপেনিং। এই দেখো অ্যান্টিরিয়র প্যাপিলারি মাসেলটা দেখা যাচ্ছে। এই দেখো অ্যান্টিরিয়র স্টার্নোকস্টাল সারফেস থেকে বেরিয়েছে, এই যে এই অ্যান্টিরিয়র প্যাপিলারি মাসেল, ঠিক আছে।
কোনটাকে বলুন স্যার?
এই প্যাপিলারি মাসেল, আলো ফেলো, আলো ফেলো, এই দেখো দেখতে পেয়েছো, এই যে অ্যান্টিরিয়র ওয়াল থেকে বেরিয়েছে অ্যান্টিরিয়র প্যাপিলারি মাসেল। তারপর দেখো ওখান থেকে কডি টেন্ডিনি গিয়ে দেখো ভাল্ব কাস্পে লেগেছে। ঠিক আছে, এটা নিজেরা নিয়ে হাতে দেখতে হবে বারে বারে। আর এইটা হচ্ছে সেপ্টোমার্জিনাল ট্র্যাবিকুলে, এই যে খানিকটা ছিঁড়েছে, খানিকটা আছে এখনো। এই যে দেখো, এটা ইন্টারভেন্ট্রিকুলার সেপ্টাম থেকে দেখো এই জিনিসটা বেরিয়েছে, সেপ্টোমার্জিনাল ট্র্যাবিকুলা। এই যে খানিকটা ছিঁড়ে গেছে, দেখো এখানে এই অংশটা ছিঁড়ে গেছে, এখান থেকে এসছে দেখো, এই দেখো এখান থেকে আসছিল, খানিকটা ছিঁড়ে গেছে এই এটা, কিন্তু খানিকটা আছেও এই এইখানে, এখান থেকে সেখানে। এটা মডারেটর ব্যান্ড, ঠিক আছে। এর মধ্যে হচ্ছে রিজেস, এটা হচ্ছে ব্রিজ এখান থেকে, আর পিলার হচ্ছে এই যে প্যাপিলারি মাসেল, ঠিক আছে। আর ব্রিজ হচ্ছে এইটা, ঠিক আছে। এই যে ব্রিজ, এটা একটা ইয়ে পাচ্ছ, দেখো ব্রিজ, দেখো এই দেখো ব্রিজ, দেখো প্যাপিলারি মাসেল টু সেপ্টাল বল, এদিকে সেপ্টাল বল, এদিকে প্যাপিলারি মাসেল, ঠিক আছে। এটা হচ্ছে সেপ্টোমার্জিনাল ট্র্যাবিকুলার, যার মধ্যে এটা এতটাই ডিসেকশন থাকবে, তারপর ছিঁড়ে যাবে, তো তারপর ডিসেকশন করলে পুরোটাই ছিঁড়ে বেরিয়ে যাবে। এই দেখো আবারও দেখাচ্ছি, দেখো এইদিকে ইন্টারভেন্ট্রিকুলার সেপ্টাম থেকে দেখো অ্যারাইজ করেছে এটা, এই দেখো করে অ্যান্টিরিয়র প্যাপিলারি মাসেলের পর্যন্ত কন্টিনিউড হয়েছে, দেখো এই যে ওইটা এইটা, ঠিক আছে। তার একটু অংশ এখানে ছিঁড়ে গেছে, কিন্তু এখান থেকে এটাও এসেছিল, এইভাবে এসেছিল। তো এটা সেপ্টোমার্জিনাল ট্র্যাবিকুলা, মানে সেপ্টাল ওয়াল, মানে ইন্টারভেন্ট্রিকুলার সেপ্টাল ওয়াল থেকে anterior papillary muscle. So it forms a conductive system. It contains the right bundle of His. Okay. SA node এখানে আছে superior vena cava, তাহলে triangle of Cox এর ভেতরেই আছে, within it we are getting AV nodes. From here bundle of His, one bundle, right bundle and left bundle. Right bundle is called the septomarginal trabeculector, যেটা এখান থেকে কানেক্টেড। দেখো এই আবার দেখাচ্ছি, এই দেখো কানেক্টেড, এই যে সেপ্টোমার্জিনাল ট্র্যাবিকুলা, এই যে এইটা septomarginal trabecula. From the septum it is going to the anterior papillary muscle. Okay, এইটুকুনি জানলেই হলো।